Hi, welcome to episode 1 of COVID-19 cases on Monroe County, New York. In this episode, we will discuss how we are doing and did the curve flatten, based on publicly available data as of June 20th, 2020. Disclaimer, this is a layperson analysis, not a professional opinion. Use caution and life applications. So why Monroe County, New York? Where is Monroe County, you ask? First of all, for those of you not familiar with New York State is in the northeastern part of the United States of America and adjacent to Canada to the north, as shown in this map. New York State is outlined in blue. It's next to the two Great Lakes, Lake Erie, Lake Ontario, 2 of the 5 Great Lakes. It's next to Vermont, Massachusetts, Connecticut, New Jersey, and Pennsylvania. New York State is dominated by New York City, located in the southeastern corner of the state down here. It's the largest metropolitan area in the United States by far, and its suburbs extend into New Jersey and Connecticut. In fact, when people refer to New York, they commonly mean New York City and ignore the rest of the state. Monroe County is in western New York, up here. In this map, the colors of Monroe County indicate the level of COVID-19 infection by zip code in Monroe County. Out here in the Wild West of New York, New York City is referred to as downstate, whereas New York City refers to all of New York outside of the New York City metro area as upstate. We in Western New York know that true upstaters live in the North Country over here. So because Monroe County is often ignored in New York State, I made this episode to examine COVID-19 concerns directly related to us. Aside, for those of you in the US who feel that New York ignores you, we feel your pain here in Western New York. To illustrate this point, here's a graph of daily new COVID-19 cases in New York State. The first documented case occurred in March 2nd in the metro area of New York City. And the lockdown occurred after March 22nd, 2020. So you can see that the crazy spike that started after, right around here, after the lockdown, it seemed to have decreased. And then the trajectory has changed afterwards and have come down dramatically since that surge. But how much of this applies to Monroe County? Here's the plot of Monroe County relative to New York State. Yep, we are pretty much insignificantly running on the bottom here. You can't even tell if we have any cases at all at this scale, with nearly 12,000 at the top and 400 at the first tick above 0 at the bottom. So we are below that. So you can see how New York City dominates the rest of the state. So what's really happening in Monroe County? Here's the Monroe County COVID-19 cases graph from the Monroe County, New York Department of Public Health. Note the scale change. The max is now at 100, 2 orders of magnitude lower than New York State, or less than 1% of New York State. Our first documented case was March 12th, 10 days later than New York State's, which is March 2nd, which was in the New York City metro area. Of course, the lockdown was same for the entire state after March 22nd. Did this earlier lockdown help us in Monroe County? The curve indeed does look flatter, and we are starting to see a downward trend also. This uptick is probably due to increased testing. More on this possibly in a later episode. So how can we tell if the curve is truly flattened? Well, we can plot the expected cases without lockdown and to compare, but we cannot really be sure of what the expected plot would be. So assumptions have to be made to guess what the curve would have been like. And the expert estimates have been speculative. So I think I can be free to speculate it on the expected as well. For this plot, I scaled up to 180 cases and then plotted a normal distribution, which is a common population estimate used in statistics, and assume the same total expected cumulative cases that we would expect from the current trend, which is about 4,000. And more on this possibly in a future episode. Then I'll assume that this curve also assumes that the time course is 8 weeks, or about 2 months to compare to. Now this is based on data from the Chinese experience, which we can possibly talk about in a later episode. And then the standard deviation, the amount of variation, is eyeballed on this normal distribution so that it overlays the initial uptick in the curve. So, indeed, the actual data looks flattened, less high, dispersed longer than the expected normal distribution. So it would be true. We have flattened the curve. In fact, if one plots a flattened curve, a flattened normal distribution, with the same total expected cumulative cases of 4,000, but now 2 times the time, 16 weeks or about 4 months, appears to fit pretty reasonably well. So yes, it looks like Monroe County has indeed flattened the curve. In summary, how are we doing? Monroe County, New York, COVID-19 cases are much less than New York City. COVID-19 curve appears flat when compared to normal expectation. So the curve indeed flattened. Job well done, Monroe County.